Welcome to the special meeting, Chapter City Council, Wednesday, May 27, 2020. Call to order at 4:50 p.m. Roll call, all council members are present. Approval of the agenda.
Make a motion to approve agenda as read.
I'll second.
We have a motion by Councilmember Givens and second by Mayor Pro Tem Lopez. Now we'll move on to public comment.
I'm sorry, Mayor Alvarado, I need a roll call. Councilmember Garcia,
Yes.
Prout.
Yes.
Alvarado,
Yes.
Lopez,
Yes.
and Givens.
Yes.
Okay, thank you. Moving on to public comments. Is there any public comments?
No public comments were received at this time.
Okay, public comments is closed. Moving on to manager's report. And the first item is return to work study session. Manager Gonzalez.
Certainly, Mayor and Council, as we all know, the economy is starting to reopen. Both the governor and the county, particularly the county, has obtained approval from the state to move forward a little bit more rapidly than what's been authorized by the governor. We're currently in stage 2 of the reopening of the economy, pursuant to the governor's directive. Where Kern County, as of last week, was approved to Kern County's plan to variate from the state reopening was approved over the weekend, and so they're moving forward with reopening businesses. As you have probably have read, and we informed you, restaurants have been allowed to reopen under certain guidelines. In-store shopping, churches have been authorized to reopen, and even salons and more personal service related type businesses have been allowed. Granted, they all have to comply with certain guidelines in the workplace. And so we too, in preparation to reopen our city offices to the general public. Now, let me just say that essential businesses like planning, building, code enforcement, those were considered essential function that were one of the 16 core infrastructure services that were allowed to remain open from the beginning. The shelter at home order was instituted. And so the other non-essential services have remained telecommuting. And so we know that we're going to be preparing to return back to the offices. And with that, CDC, Center of Disease Control, and Cal OSHA have put out guidelines for employers to adhere to and to follow. These are recommended guidelines to create a safe environment for our employees as well as members of the public. So consistent with those guidelines, we too have put together our protocols, and this was put together relatively quick thanks to the creation and the leadership of our HR manager to put together a health and safety committee. This is a committee comprised of interdepartmental employees that were assigned to the committee, either voluntarily or asked to volunteer. And in a relatively short time, they were able to take the lead and look at each department individually. Each department is going to have a unique set of protocols consistent with the type of service they provide. Finance may have their own, that may be different than the city manager's office, may be different than planning, or even TV. That's just an example of how each department's been looked at separately. So with that in mind, we looked at 4 different areas in developing our protocols. We looked at physical re-entry. That is, who do we need to have on site, where, when, how, and safety. Social distancing, staff and the public, barriers, space on reconfiguring offices and workplaces. You're going to hear from our HR manager, Carol, talk about how we are reconfiguring certain areas of City Hall in order to create social distancing, as well as reassigning staff to different offices to create safe distances. We also looked at programmatic re-entry, which programs do we start, why, when, how much, and what are the safety considerations. Electronic government transactions. Do we want to encourage more of our residents to pay online, for example, their utility bills versus coming into City Hall? So we looked, that's an example of some of the areas we looked at. And then immediate process improvements that we need to institute. And that's really looking at outside the box. We know that when we reopen our doors, business as usual, our good service models as we knew them prior to COVID-19, we're not going to be able to come right back to the workplace in itself is going to look different. Therefore, the service models are going to be different. Just like the general public, we've all had to adjust, wearing masks, hand sanitizer, wherever we went. So too, it's going to be when we reopen our offices. There's going to be slight inconvenience for our employees or residents, but it's all a safety measure in mind to protect the general public and out of respect and consideration of the coworkers and their peers, not knowing what their home life may be. We looked at operational reentry. What are the return to work policy updates? We anticipate a request for a hazard pay. Not in this case, but that's an area that's been brought up. We looked at staggered schedules, right? We know that we can't have all our employees at once because our facilities are not adequate for social distance. So directors have looked at, do we stagger employees in order to have sufficient coverage to provide the service, yet still also comply with social distancing. One of the, for example, we're in this room today, one of the recommendations that have been provided that in order to maintain 6 feet of social distancing around an individual, we need approximately 144 square feet of space from one person to the other. So those are considerations we've had to take in the workplace. And again, new and different work practices as we move forward, knowing that we're going to have service delivery models. You're going to hear Carol talk about some of the considerations we're having for the public to be able to have like a walk-up customer service window for our residents to come and pay the utility bills versus having to come into City Hall. We're making it a little bit easier for both the public and for our employees. And then, of course, in the workplace, we looked at social and team reentry. It goes without saying that, you know, we spend a lot of time at work. Our employees will probably, you know, just simple hello, how's it going? How was your weekend? Right? So that water cooler kind of talk that used to take place no longer is going to be, right? Casually stopping and say, hey, how you doing today? What you think of the game, whatever. A lot of that's going to go away, unfortunately. So we had to look at that. We had to look at the transition of emergency telework to long-term. We were talking about just, Councilmember Giddens and I were just kind of talking about how telecommuting, there's studies now that are showing that telecommuting has increased productivity in some instances because you've eliminated commute time, you've eliminated cooler time. You know, a lot of that time spent on non-work related tasks are now more focused working at home. Employee communication, usual meetings, hey, let's call for a meeting. It's not going to be as easy as before. We may even find ourselves in City Hall where we're still having Zoom meetings simply because we need to maintain social distancing and because our space is not adequate enough for that to meet that social distancing. And then just overall the organizational culture of how we interact with one another. And then, of course, maintaining the overall well-being and health of our employees. That's going to be important. A lot of businesses are talking about temperature checks. They're talking about masks in the workplace, hand sanitizer, all these other safety measures, you know, not congregating in employee break rooms, but maintaining separation. So all of those are all considerations that we too have to take. And then just overall, even teamwork strategies. You know, usually we form teams to work on a particular project. That in itself is going to change. And so these are all 4 different areas: fiscal reentry, programmatic, operational, social, and team areas that we looked at and took into consideration as we developed our protocols. We understand that these protocols are going to be a living and breathing document. There's no playbook that specifically tells the employer how we should react and how should we reopen our doors. And so we are going to have to stay fluid, flexible, and realize that we may have to adopt and adjust as we move forward with these protocols. They're not set in stone. And also, too, CDC and OSHA, based on other cases, may provide new guidance in the workplace. So those are all considerations that we'll have to keep in mind as we move forward. So this is very much a living, breathing document that will require us to stay flexible and be able to adjust quickly. As of right now, we don't have a timeline as to when the governor is giving the order for non-essential offices to open. We're anticipating that it's going to be probably the next week or two. We are working to install and make those modifications to our building, like at City Hall, where we look at reassigning certain individuals to different offices. So that takes a little bit of time. IT has to go in and set up new computer workstations. So we're about a week and a half from being able to complete all that. So tentatively, we're looking possibly on June 8th, that Monday, that we will be ready if the governor authorizes the non-essential offices to reopen our doors to the public. As it is now, some employees have been coming into City Hall to provide certain essential services, like making sure vendors are paid, making sure that payroll is processed, receipts for utilities are also processed. And that's an example. Mail is open, so that mail doesn't stack up, and important correspondence doesn't get lost. And so that's continuing. We just haven't been open to the public. This is an interactive process. Again, these guidelines, these protocols were developed in a departmental format and setting, and are consistent with what CDC, OSHA, and the health department guidelines have been. So with that, I'd like to ask our HR manager, Carol, who will provide the presentation on the protocols, and then our department directors are available for any questions you may have specific to a particular department, say Public Works, and how we're maintaining social distance in that department. So it's a very much interactive process. So with that, Mayor, I'd like to ask Carol to go ahead and proceed with the presentation. Okay.
Mayor and council members, recently we established a health and safety committee, which has assisted with coming up with these protocols. Once those protocols were established, they have not been established, they were proposed. They were taken to department heads and the city manager to review and comment, and modifications were made as necessary. Now, council was provided with those specific protocols, and we'll just this is going to be an overview of, or a highlight of those protocols. So the objective of the protocols is to ensure that the city facilities and work sites are healthy and safe for employees and members of the public upon reopening, and that they remain still moving forward. Like previously mentioned, they are consistent with CDC and County Public Health and Cal OSHA. Citywide protocols regarding facility barriers. It is proposed that installation of wellness windows, which are the sneeze guards, that's similar to what you may have already seen in grocery stores, that they be placed in areas where city employees interact with the public. So for example, like city services, the finance department already has a window, but it needs that extra security measure. And then other places citywide. Now, despite these barriers, social distancing and the usage of masks is still going to be recommended and required. So all employees will be required to use masks while at work, as well as anybody entering the building.
You're saying additional barrier for finance right now? What?
It's an additional, so the plexiglass or a window is not a replacement of the requirement of having to use a mask.
Okay, so we're not adding additional plexi to what's already existing there. You're just saying.
So they're going to add it to, so right now there's currently 2 windows, and so they're going to add it in between those 2 windows.
For the workers.
Inside.
Okay, I thought you were talking about.
No.
Okay, thank you.
But they are going to be, our workers are going to be protected. They'll have something in front of them as well, right?
Correct.
Like when you go pull a permit, our ladies will have something there. That's good.
And they're already there. So staff has been making those purchases just because we want to make sure that we can get a hold of those things. So city services already has them up. I've been there several times this week, and so they already have them. And Marshall, which is the facility construction specialist, has been placing orders for other departments to make sure that we can get a hold of
So just that unit here, interchangeably, the safety measures for employees with the public in terms of barriers. And then we also have to keep in mind and consider within the workspace of safety measures between coworker and coworker.
So the mask has to be worn the whole time in all three?
The only time that employees will not be required to wear the mask is if you have your own office. So if you're by yourself in the office, then you don't have to wear the mask. But as soon as you step out to any communal area, then you will have to make sure that you have your mask. Now, city employees have been provided with 3 masks so that they have the ability to wash those, and they will be given CDC guidelines as to how to take care of those so that we make sure they always have a mask. And they were already distributed last week.
That's good. And the mask, to be honest with you, we had some discussion on that in terms of, the safety of wearing one, but it's more for the consideration of your coworker. We don't know what that coworker's life, maybe at home, might have a child that's high risk of asthma, or whatever the case may be. They might have an elderly parent or relative that lives with them, and so they come out, they get exposed, they go home. So again, if we're in the hallway, we're in the break room, the coffee room, we're asking all employees to wear a mask and be considerate. And there's a lot of debate publicly, as to whether we should or shouldn't wear a mask. And so we're asking that employees will be required, and therefore, as we provided to you, the mask that employees aren't having to then try to shop it. So that's where that requirement's coming.
The city will continue to restrict facility access to employees and the public. I will go more into detail it's listed under the department protocol. So once I get there, I will go more into detail. Now, should a resident request interaction with an employee, employees will make themselves available following proper safety protocol. We will do our best to continue doing our virtual meetings. So even if employees are at City Hall and we schedule a meeting, so we will do the meeting from our office or work area. We're going to reduce the amount of time or amount of people that are in the same room, so we will not be using the conference room unless it's less than 10 people. However, we will focus on using either Zoom or GoToMeeting. I've already mentioned previously that we are providing employees with masks. They will be required to wear them, as well as anyone that's entering the building. So as the public is allowed to go into the building, whoever is allowing them to go in will ask them to please wear masks. We will also be doing morning temperature and wellness checks, which I just had a meeting with the Health and Safety Committee this afternoon, and where they are requesting that we have 2 options available where we will set up a station at each work site where we'll have a contactless thermometer, and then there'll be a questionnaire for symptoms that they will check. If they have a fever of 100.4 or have any symptoms, they're going to report it to HR, and then HR will provide them with further direction. If they don't want to do the self-evaluation at work, then they can do it before they leave their house in the morning. So either way, it's self-evaluation, whether you do it from home or if you do it at work. I know sometimes people just don't have time to do it before they leave the house, so it'll at least be there available for them at work.
With regards to the temperature checks, there's debate again on that, whether that's a violation of a person's Fourth Amendment in terms of search of a person, because you're asking them to take that temperature, provide that. So there's discussion in the legal world as to whether that is or is a violation of the Fourth Amendment. There's not yet been any legal challenges that we're aware of in terms of somebody filing a suit. That this is somehow a violation of the Fourth Amendment, but this is just some talks that are taking place. Until there is a case law that, with a legal opinion that says, yes, it's a violation or not, we're going to continue to ask employees to do the temperature test, just like a lot of employers are asking their employees to do that. It's a good practice. You know, some of you were talking ideas that in your workplace, you're required to do that, right? Again, it may not necessarily be for yourself, but being that a lot of individuals may be symptomatic and are tested, again, it's to protect your coworkers and the environment of which everyone is in and around that location. So just be aware of that. We are cognizant of the fact that there is these discussions taking place about the challenge on the Fourth Amendment as it relates to temperature checks. We're monitoring it, and if there's any changes in terms of not only the legal challenge, but the case law that says yes, we will comply with whatever the statute and all is.
Directors will work with their departments to determine when and how to re-enroll employees back to work. And those employees who can still function at a high capacity remotely should continue to do so for as long as it's practical. We want to reduce the amount of people that are in the building, so it may be that we have alternate work schedules where maybe one day one employee works from the office while the other telecommutes. We are also recommending that if there's a department, for example, of 4, maybe they can schedule 2 people in the office one day and then the other 2 people the next day. And we want to make sure that those 2 people are the same ones that work together all the time. You're not alternating them. Directors will try to limit employee movement within the building or between buildings. And employees with underlying health concerns or with family members that are high risk category are being asked to report back to their director and HR so that we can come up with the best solution. Now, this may be considered a request for reasonable accommodation and shall be consistent with any regulations set forth by the Americans with Disability Act and the Fair Employment and Housing Act. Going into department controls, this is specific to each department. So at City Hall, which consists of the annex building, the building department, business development director, city clerk's office, city manager, finance, human resources, and planning. City Hall business hours will be 8 a.m. to 5 p.m. Monday through Friday. The building department public access restrictions will be to conduct business from the current HR office. Only one person will be allowed in the lobby area at one time. And public wishing to speak with the building staff shall be by appointment only. So I'm not sure if you guys are familiar with that area where currently it's the HR office. There's a window there, and so they'll be using that for typists to provide service from that office. And she'll be the only one in there. Finance department, public access will be from 9 a.m. to 5 p.m. They will be there at 8 o'clock, but public access will start at 9 o'clock. It'll be limited to 2 people in the hallway at the same time, and they will follow any social distancing protocols. They're also looking into doing a walk-up window, and so I believe our public works director and our business official are assisting the administrative services director right now with establishing that. We'll provide more information as to how that will work. As of right now, I just know that they're working on it, so I just don't know much details.
The area we're looking at is to the south side of City Hall, next to the alley. And so we reached out to, for example, the Mexican restaurant in that alley to make sure we don't impede, but what we're going to, it's going to be on a trial basis. And it's put some barriers up to protect the general public lining up for the walk-up window. And so we're taking consideration of not impeding on the business by blocking off access to them or deliveries that go through the alley. But again, we want to afford an opportunity for the general public and our employees by creating a safe environment for them. But at the end, we find that it's just creating too many problems. Obviously, we'll take it down and we'll look for alternative. But we're trying to be creative. And like I said, our service models that before may not necessarily be what we come back to. And so we're going to deploy that on a pilot basis and try it for a couple months. If it works, then the other just be under alternative for our customers to come in and get services, particularly for favorite utilities.
For business development, arrangements to do business with the director must be by appointment only. City manager, city clerk department, all matters requiring assistance shall be by appointment only. And the public is to email either administrative assistant Rachel Cermeño, or for city clerk, they would email cityclerk@chapter.com. HR, employees or applicants may contact the Human Resources Department via telephone or email for assistance. Any matters requiring in-person assistance shall be by appointment only. Planning, any matters requiring in-person assistance shall be by appointment only. We're trying to limit the amount of people that go in and out of the building, so a lot of it is going to be by appointment only. There's going to be a lot of movement at City Hall, so there's the employment workstation, the assignment for the human resources is I will be moving into what is currently the business development director's office. He will be moving over to the public works director's office, and the public works director will be moving out to the new courtyard.
Was that the plan for the people there? As far as Mike being out there?
Initially, it was not.
It was not.
It was not. And then,
But as we had the discussion, it kind of makes sense. When all the engineering staff is over there, GIS is over there. He was basically the other one that was still here at City Hall. So we can move, and they have plenty of space over there. So that's probably already to facility over there, and there's plenty of office space for him. And so we're going to be hands-on with his staff at that site. It's great.
HR has 2 staff members, and so they will be taking 2 vacant offices in the trailer extension to City Hall. Finance department, the administrative services director, once we do have one, will be in the finance conference room. Payroll technician was moved over to the vacant administrative services director's office. And the account clerk was moved over to the payroll technician's cubicle. And that was all because there was an account clerk and an account clerk 2 that were just, it didn't allow that social distancing, so they needed to do that. City services, so the clerk typist will move into the current HR office, and she will work from there to provide service to the public. The existing window has small enough openings so they, whether it's money or paperwork, they can slide it through that opening. There is an existing cashiering system which will have to be relocated so that it's conveniently placed for transactions. And any large-scale items will have to be placed at the current counter for appropriate staff members to pick up. I've already provided the information regarding the public works director and the business development director. Do you guys have any questions regarding those movements.
I wanted to go back to, you're gonna do a drive-up window, is that what you talked about, a drive-up big?
That was the initial conversation, and I believe there were certain concerns about that. And
So a drive-through window was an idea that was explored to, again, allow the person to just drive up, you know, pay by check or credit card, keep something inside the car, not having to get out, and then just go about their business and also protect the shield, protect employees. But with traffic flows after our public works director and Dennis looked at it at City Hall and its configuration, you have a parking lot with that trailer that could have served it, but it could have potentially blocked all of the parking lot area. We looked at the alley, but with traffic going in and deliveries going, people going to the restaurant, we would have probably competed on the businesses. So the alternative that we're going to try, which I described earlier, was a walk-up for residents to be able to park in the parking lot, and then if they don't want inside the City Hall, they can just come to the exterior and pay the utility level on these from the walk-up. So we're going to try that on a pilot basis to see if it functions.
Explain a little more to me as to why they can't just walk up, I mean, park like they always do in the street. And they walk up and they go up and there's two windows there. The only thing that I saw was kind of different is that you only want to have two people in the hallway, right?
Well, the finance is a tool.
It's 2 minutes.
Yeah, and two people in the hallway. So that's what I'm saying. So why do you still need to add another park your car and walk up?
That's an alternative. So again, we're trying to make this as easy on the customer as it is for the safety of the employee. There might be a high risk customer that doesn't necessarily want to come into our offices. And so this might be an alternative for them to just walk up to the exterior window, not feel that they're around anybody.
Sure.
They're actually going into an actual environment, and they're just coming up to the walk-up window to make their payment.
Because
At the end of the day, there's no utilization of say, after 30 days, and we keep track of it, there are 10 people that came through. What we do away with, right? Again, some of the safety measures were instituted. There's no playbook, and so we're just trying to provide those as an alternative to the public and to the customer, that they feel that I don't want to go inside of them, but I'll do
Okay.
the walk-up.
the only comment I already have is that we've already encouraged people to use the drop box, as well as I've done, which I never did before. And so if we continue to just tell them, because it's simple if you're just walking up to get payment versus if you have to deal with procedure or whatever, then you have to have people come in. But if you just even have a sign out there saying, use the drop box, they walk back and just drop in. I wouldn't bother with the window.
And so as we said, we have the drop box. We're going to encourage people to use now with the new utilities building module that was deployed under units to do electronic. Preferably, we would like everybody to be on electronic payment, right? And do all with the drop box. But Sylvia, our finance manager, will tell you that we have a lot of cash customers that, for whatever reason, they still prefer every month to come in with cash. And so for those individuals that still do that method for whatever reason, they like check, and don't feel comfortable dropping their cash in an envelope in the drop box, and rather than go and pay physically and get a receipt, then for those individuals, this is an alternative for them to be able to do that. And again, service models that we, as in the way we deployed in my business in the past pre-COVID-19, are not applicable to today's environment. Again, we want to afford our customers as many options as possible for them to be able to still conduct business with us, keep in mind to protect our employees as well as the general public.
And Lowe's and Home Depot, they're doing, they got that line at the way now. And, again, they're doing it for, a lot of the safety reasons. So, but I just want to thank you for putting this together, Carol. Thank you.
Another alternative to look at is a curbside service, right, for the restaurants, right? Some restaurants have this no contact curbside pickup. You called ahead and you drove up, and so you called the number, someone came out, put your food in the back seat, and you drove off. Similarly here, it's just an alternative to try that. As I said, it's not costing us a lot of money to modify one of the existing windows to be able to provide that. A lot of these expenditures will be reimbursable under the CARES funding that it's the expenditure and what we're eligible to spend it on is COVID-19 safety measures that the county has authorized us to enter into this reimbursement. In fact, on the next council meeting, you can see the agreement between the city and the county for that $698,000 approximately. So the general fund won't necessarily be out the money, but they understand that there has to be certain safety measures that have to be put into place to be able to work in this new environment.
That wasn't concerning me. You're gonna have a person that's always ready for the window. The reason, when you go to the bank, like Mission Bank, for instance, they have a drive up. And so someone has to be watching that window all the time, and then they have to be ready to respond. You know, I was just trying to get clarification. Because if I were to go out today, you were telling me that it's maybe temporary and it may not work, and yet it may, but we don't know what it's gonna be.
Like a lot of things, like I said, we're going to try on a trial basis. You know, there's nothing that says that the protocols we have in place today is what's going to remain 90 days from now, because there might be new guidelines for the workplace. Maybe they make temperature checks mandatory, or wearing a face mask, or whatever the case may be.
Could get more so or less.
Exactly.
Are we getting most of our bills paid, like in terms of the people with water? Are they been paying well still?
They have, but keep in mind that right now they're not charging like the late fees and they're not shutting off. And so we anticipate that once we're allowed to shut people off, there's going to be heavy traffic. A lot of people are going to be heavy.
Well, it probably didn't help either that they just did that rollover of the new system. So that was April 22nd was the rollover.
Yes.
So you probably had some weirdness that's happened.
Yeah.
I'm an online payer.
Bills were later.
So I know, that whole thing was kind of a jumping mess from that.
Yeah.
So that's probably bad data to look at.
Yeah.
Sylvia, can you respond to that? I can tell you that we have been still taking payments. The local store where people can go and make
Oh, great.
payments. We've been still taking those cash receipts. We have the drop box, and then of course people still have the ability to pay online. So all of those good methods
Hi.
in place. But let me have Sylvia chime in on here real quick. She would have a better idea on that. To your question.
Okay, can you hear me?
Yeah, what am I? No, we hear.
It's still pretty much status quo for finance department. Myers is taking the bulk of the cash payments. We just sent out the new billing. We've had positive feedback. We are live with the credit card payments. We've had a lot of people calling in trying to figure out the new system. Where we're having to kind of modify the customers is when people are either turning services on or off. Right now in this environment, we've had to kind of modify a lot of what we're doing. Normally we require the either a deed or a rental contract. So a lot of that stuff, we're just kind of having to trust the customers. But these are where the customers are going to have to actually come in. We're trying to, once we get up CSS, which I think Brittany already said, we already have it pretty much going, where customers will have the ability to upload a lot of that. There won't be really a need for customers to continue to come in, but we're going to have to kind of play it by ear. Also, currently, we haven't charged any late fees since January. There was a new ruling that went out with the, even prior to the COVID, the shut-off policies that we were, now we have to maintain this certain protocols in order before we actually shut someone off. So with that, then we also have now the COVID restrictions of being able to shut people off. So my concern is later on down the road is that some of these people are going to be, their balances are going to be significantly high. And I think that we're going to need to address some type of action, or, as we go forward. I don't know, maybe in a couple of months, and then also I'm not sure what is going to trump. Is it going to be the new shut-off policies that were implemented January 1st, or is it going to be the COVID? I don't know how long the COVID event is going to last. So, but there's going to be a time where we do have to start kind of telling these people, you know, they're going to have to pay. I mean, a lot of them, some of the balances are like up to $500-600. These people have just ignored some of these balances. So I think that at that point, people are going to have to come into City Hall where we're going to have to sit down and evaluate their future billings and come up with some type of payment agreement.
Thank you, Sylvia. Answer your question.
Yeah, thank you. I was curious. And I think she's right. I've had a tenant and they've been saying, hey, they call me, Mr. Garcia, but they were just saying that they've been trying to get their water turned on. I told them it's going to be tough right now, but you got to call and email them. It worked that way. But I told them I don't think they're going to be shutting you off, but be ready to go when you got to pay that $300 that you missed. They haven't saved, they're ready, but I just was wondering. So.
Okay, so regarding public meetings, they will continue to be done via teleconference technology. However, anytime, just like we are today, if we do any council meetings, we will be using this conference room at the police department, or there's also the Veterans Hall building. Currently, the council chambers is being used as a storage for office equipment. As things are needed to be moved around at City Hall, that's where things are being stored right now.
Utilizing the public works yard is undoable in the neighbors.
It was just recently temporarily moved in there. We were notified by Administrative Services Director this morning that there was some kind of filing cabinet placement due to the current moving in.
This is just office furniture,
Yeah.
as we move, we go from one office to another, we're storing it temporarily while one person moves out, and then we're going to go to that new office. So
This is nice of here. I didn't think it was this nice. I never been here. Yeah, Jim.
And just as a note is that although we're reopening, the governor's still has not lifted the gathering of 10 member individuals. That still continues to be in place. So even as we return back to work, until that restriction is lifted to 20 or 25, we're still limited to how many people can be in any type of a gathering of 10, basically 9. Right? So as we are here, we're pretty much to the max. And if we have the public attending via Zoom or email visitors or YouTube. So we're mindful of that as well, that we still have that restriction on us that we can't gather.
So those are the specifics for City Hall. Do you guys have any other questions regarding City Hall?
So just one quick, so are we planning to start doing our council meetings here?
So this was a test run, and so you council can give us feedback, and we had planned to do a test run today. If this works and you're comfortable with this, we can start having our regular council meetings in this type of setting as well. I'm not sure we'll work out the technical issues with streaming on YouTube during the meeting so that our residents can still view the meeting. But given, as I mentioned earlier, the guideline is 144 square feet. There's circumference. This provides adequate. We looked at our council chambers. It's still a little too narrow and compressed to really be functional. And here we still have the microphones. We have the screen. We're able to set up the podium. So unless you can correct otherwise, I think this might serve functional to the council. We can continue to do that. And then we were planning the June 2nd meeting and thereafter the whole meeting.
Do you like it, Chandler?
Bringing in coffee, what that sounds like.
Yeah, we can get some snacks in here and some water.
I knew that was going to be his comment. Where's the coffee?
Well, it's only fair to comment that the public really wants to be in attendance. So, I think that's what we're hoping to get to eventually.
Can you open that up? I'm just curious.
Yeah, you can.
Oh, get them in there.
Yeah, it's just how there's no definition of 10 or more. Is that still considered a gathering of 10 or more? I don't know. I mean, I guess we can check with public health and we can ask Brent, we can say it's a separate room.
Theoretically, if you follow the Google tracing guidelines, about 25% of it less.
For restaurants. Bring the carpet.
Still a lot of unknowns.
Still.
As of right now, as far as with the 10, can we want to continue going here? I guess that's the first question, first step. So is there any need direction? Or
No, just,
Okay.
if you find that this is just consensus, and I don't need to vote upon it, we are at a study session, so it doesn't require formal voting, but if there's general consensus that we will continue to plan for the June 2nd meeting, and then they say we'll work out the technical issues with YouTube, and we'll just plan on having our meetings here for the time being.
I'm fine with that.
Versus Zoom, I mean,
I'm good. Caesar, you like it? Or Kathy, you like it? Or- Maybe like you said, just a coffee, but on the end. Look at that water for me. I don't drink coffee with 110.
No, we need a wedding night.
Okay, thank you.
is that suitable with council?
Well, we're gonna go back to council chambers eventually.
Eventually, yes, once they lift that restriction, the social distancing, from what we've read, both from CDC, OSHA, that's gonna continue in place for quite some time. They haven't given any idea whether that's gonna get lifted or not. But the social distancing factor is what's gonna drive the meeting location in terms of not 144 square foot inches or,
Well, definitely this is the start.
yes.
Okay.
The alternative, we can open that up, and that might create that, if they say, gatherings of 20 or 25, we can open that up. And you've probably seen pictures of like parks, where they've had circles that measure the distance from one to the other.
Oh, yeah.
Similarly, we can do something like that, and there to make sure that people adhere to it, and we can comply. Changing times, that's for sure.
So moving on to engineering, GIS, and pretty soon public works. I believe it was mentioned they will be moving over there sometime next week. Their hours of operation are 7:30 to 4:30. Typically, that facility is always closed to the public, so anyone that does business over there is by appointment only. There are no changes as to assignments other than the public works director is being over there. Any questions regarding that facility? And then the Chapter Learning Center shall be on the same schedule as the library. Their hours will be 11 a.m. to 7 p.m. Monday through Thursday. All classes will be online. One-on-one tutoring will be available in person, but by appointment only. Patrons required to make appointments to use computers or tutoring, and patrons may bring only one person if they need help using the computers. Scheduled appointments apart if one customer is asking to bring someone with them. Any questions regarding the Learning Center? For the NCCF, there's nothing has changed. Their office hours are 7:30 to 3:30. They are considered essential function employees, with the exception of some clerks and education staff. They are following CDCR guidelines regarding COVID-19, and so anything that's, they have the restrictions for public access that was in place prior to COVID-19. So any questions regarding the NCCF? Police Department, animal control, reopening of the shelter for adoption program in collaboration with animal rescue partners shall be from 9 a.m. to 3 p.m. Monday, Tuesday, and Thursday through Saturday. They're open from 1 to 7 on Wednesdays. Public access to the shelter will resume by appointment only and screening. Doors will remain secured and appointments limited to ensure distancing. Masks will be required for all scheduled appointments, and persons will be advised prior to arriving. They will not provide masks, so the public will have to have their own masks. The police department property room. Property will revise its availability to process property by appointment only and the screening. Property will be available Monday through Friday from 8 a.m. to 2 p.m. Property access will be by appointment only and screening process. The police department lobby and records, accessibility will be Monday through Friday from 8 a.m. to 2 p.m. for standard public requests such as general inquiries, vehicle release or hearings, report requests, citation sign-offs, CCW application, renewals or registrants, public records requests, or any complaints. It is recommended that the lobby doors of the police department remain secure. This will allow members of the dispatch center to limit the number of people in the lobby to ensure proper social distancing guidelines are maintained. Persons will be allowed in for general inquiries after verbal screening. It is preferred for the public to make appointments so that they may be verbally screened. However, the public may still be allowed to go in if there are no persons in process or waiting. Persons with appointments will receive priority over those without. Mask and verbal screenings are required. Most of these processes can be accomplished via the protective glass barriers that currently exist. There is a concern regarding the live scan, just because that's one of the areas where there's contact with people. And so those will be done by appointment only, and people will be required to wear masks and go through certain criteria for the live scans. Any questions regarding the police department? For the public works yard, their hours of operation is 7 a.m. to 4:30. The facility is closed to the public. Arrangements to do business with employees must be by appointment only. As essential workers, public works employees will continue to report daily to support routine and emergency operations for the duration of the COVID-19 pandemic. And field crews and managers will continue to practice the safest work habits possible through social distancing and routine use of personal protective equipment. Any questions regarding public works? For transit, only one bus and 2 minivans shall operate until the new buses come in the fall. The vendor has been contacted in hopes that they can install COVID-19 protection devices onto the new buses. The building official and facilities maintenance worker will assist with minor retrofitting to the current buses as they will be replaced once the new buses arrive. Safeguards will be installed to protect the driver. There will be a limit on the number of passengers carried at any given time, requiring them to self-distance as best possible while in the vehicle. At the end of the day, the vehicles will be sanitized. Arrangements are being made with the current janitorial contractor to do the work. The cleaning may consist of using sanitation bombs. If this method is used, the next morning the driver will be responsible for cleaning off the residue left by the sanitary bombs. The hours of operations are to be determined at this time and shall begin a half hour later so that the drivers have enough time to clean the vehicles. Masks shall be mandatory for passengers. Drivers will be required to wear a mask as well as gloves to protect themselves from the money that they will be taking from the passengers. Any questions regarding transit?
Where are our dial? They are currently.
They are currently furloughed, yes.
They are ready to come back. Did they go anywhere?
They're just waiting for us to call in and say, come back to work.
We might start them in June, this June date, June 8th.
Yeah, so we had an internal meeting to talk about putting in place the safety measures and events for retrofit certain safety sneeze guards for the driver, how to deal with the cash issues. So as soon as those vehicles are ready, I think we're just going to give it a 2 week lead time to make those retrofits in the buses and move them. Then we'll be ready to do that. service will be limited, meaning that we are on the transport just a few passengers at a time, so wait times may be a little bit longer. But those are just, again, the new type of safety measures we have in place. And our finance manager, Sylvia, and I participated on a regional call in the center of the Central Valley, Kings County, Tulare, in southern South Kings Valley, transit operators, and talking. It was a brainstorming session on all the different transit operators on what everybody was doing, how they were addressing certain issues. I can tell you that again, there's no one size fits all. Sylvia was very forethought and asking a question in terms of what some of the agencies were doing. And it was silent. Everybody is just kind of trying to figure it out as we go. But we're talking, and we're all borrowing ideas from one another. And I know to the point I said that take some measures, maybe do more or less, and we just deploy that as we get guidelines from OSHA, CDC, and then just among ourselves as best practices.
Because the new buses coming in are larger.
Yes, sir.
So that'll help. That's not so far.
Yeah.
So
And I think our public works director, who was part of the procurement process, reached out and I believe that we can install some of these measures at the factory before we take the delivery. I'm sure they're getting inputs from other transit systems that have purchased their buses of the same request. So this is just sort of the new norm, if you will, of how we're going to operate.
So this is just an overview of the protocols that council was provided with, and like previously mentioned, excuse me, we will, with the assistance of the health and safety committee, we will constantly monitor these protocols and make decisions as to whether adjustments need to occur. And typically that's if there's a new law or regulation that is related to COVID-19 that we have to take into consideration, we will, and the protocols will be updated as necessary. So does council have any additional questions?
I don't know.
Good job, everyone.
So, Senator Council, just to close, as you've heard, basically we are changing our workplace environment with social distancing, but we're not necessarily enlarging our real estate footprint. Right? We're making it work with what we have. In one regard, we feel fortunate that we have the new public works building that we can move up some of our, spread out some of our staff. As you've heard, we took into consideration new staffing models. We've taken into consideration new service delivery models with a health focus of standard operating procedures, first and foremost. We're incorporating technology wherever we can in the workplace, within one office to another, instead of being in person, so video conferencing, and also looking to improve and maintain the productivity of what we do and how we provide those jobs as we maintain social distance. That productivity is going to decrease. Our commitment is to continue to provide services to our residents at a quality level. And so we plan to do that and develop these protocols with that in mind. And of course, to maintain a safe work environment for our employees and as well for our members of the public coming to utilize our services. And so a lot of work went into this. This was informational to let you know that we have a plan to the protocols in place for when we do return back. We've taken that into a lot of considerations, a lot of discussion, and a lot of credit goes to the department directors, the health and safety committee members that are not directors, because some of our line staff have participated, and then of course the leadership of our HR director to guide the health and safety committee with this. And then I just ask your patience, some forgiveness from our customers. There might be some inconveniences even for us having to wear a mask in the hallway under the copy room or the case with meetings. That it's just something that we're going to have to do until such time that we no longer have to do it. But again, this is fluid, it's flexible, and we'll continue to keep you informed as we go back to the workplace. So thank you for your consideration and your input and discussion. We have nothing further at this time.
Okay, well, thank you very much for being here, and I get a motion to adjourn.
I'll make a motion to adjourn.
Second.
Motion by Councilman Booth, second by Councilman Garcia, all in favor?
Aye.
We're adjourned.
Thank you, Carol. Thank you, Gabriel. Johnny, even though you met